Welcome to another VerbLink class. Today's class is about conversation. We're going to talk about, well, one of three subjects. We can talk about health, robot armies, or one world government. Students will pick a topic, and then we'll spend the class having a conversation. We'll get started shortly once students arrive in the class. Hi, Jan.
Hi, can you hear me?
I can.
Great.
Where are you joining us from?
From US.
Which part of the U.S.? The East or the West?
West California.
Oh, okay. So it's 4 o'clock in the afternoon there.
Yeah. How about you?
Well, I'm on I'm in the Eastern time zone, but I'm in Central Canada.
Okay. So it's 7 p.m.?
7 o'clock. That's correct.
Okay. Oh, looks like just I'm the only student in this classroom.
I know you think that and you hope that, but I can assure you within a few minutes we'll probably have a flood of students come in.
Okay.
This is my first time having class with you.
Yeah.
Is it your first?
Yeah. Okay, they're coming.
I told you they would. As a
I'm the
teacher, we
most
can tell if
punctual.
our classes are sold out or not.
I'm sorry?
As a teacher, we can see what students are joining our classes. So I can always tell if it's a full class or not.
Okay.
All right,
Because
yeah.
I think I got the last ticket of this class.
Yeah, it sold out pretty quickly. It quite often does. Well,
Right
thank you,
after I
Jan.
click.
Thank you, Jan, for
Right.
joining us. Let me just do some introductions and say hi to everybody, and then we'll get started. Hello, Maria.
Hello.
How are you?
Fine, and you?
I'm good, thanks. Where are you from?
I am from Spain.
Spain. Oh, it's late in the evening there. Very late.
Yes.
It's actually Thursday morning.
Yes, but usually in Spain, people go to the bed very later.
Oh, well, perfect then. Well, thank you for joining us.
Okay, thanks.
German, welcome back.
Hey Simon, nice to see you again.
Good. I'm glad to see you're becoming a regular once again.
Thank you.
And Carolina, thanks for coming back.
Hello, teacher. How are you?
Good. How was your day?
My day was good. So it was good.
Okay, good. Excellent. And Anna, good to see you back again. How was your day?
My day was studying English with my fellows, Caroline and German. We've been overdosing in English.
That's not a bad thing, although I might suggest a break once in a while. Even I get tired of English, and sometimes I just sit and watch a movie. All right, thank you very much, Anna. And Amp, welcome back, Amp.
Hi, teacher. How are you?
I'm feeling a little bit better. I was very, very sore earlier.
And it's really hot today.
Yeah, let me show you guys the radar and the temperature. I don't over-exaggerate. It is a scorcher here today. Even though it's 7 o'clock at night, it's still 87 degrees, although it feels like it's 100, which is close to 40.
Yeah.
But we have all these lakes to help keep us cool. They're just not doing a very good job right now. And for those of you unfamiliar, this is where I live in around this area here, just above this big lake here. All right. So today is a conversation class, as I'm sure you're aware. I've been picking the class topics recently, and today I'm going to let you guys do a bit of voting, which is almost related to the first topic. So in group chat, you'll see 3 subjects. 1 is a one world government, 2, health, and 3, robot armies. These might seem like strange topics, but they're all in the news in some way. So please go to group chat, select one, and type the number. Whichever has the most votes, that's the subject we'll deal with. One world government, health, tied for first. Oh, we've got all of them now. 3 is, okay, so health is leading. Now health is tied with one world government. One world government is tied with health. And we've got, oh, a 2. It looks like 2 wins. All right, so we're going to talk about health. All right, so let's start with AMP. AMP, and I keep forgetting, not all of you are familiar with the rules of my class, so let me explain. I use a stopwatch. When the timer hits, or you run out of time, you'll hear this sound. When you hear this sound, you need to stop talking, otherwise German will send a bolt of electricity and shock you. So definitely stop talking when you hear the chimes. Now, at the bottom of the screen, you'll see an image of everybody. I usually either start from right and go to left, or start from left and go to right. Okay, so I'm starting with AMP this time. And AMP, we've got a minute. What about health is important to you? What do you think about when you think about health?
Well, because without health, you are not able to work. You are not able to take care of the others in your family, and you need to be healthy. And people don't care too much about what they are eating or the amount of exercise that they do every day. But when you are becoming older, yes, you start just feeling the consequences of your body taking care of your own life. And the system of health is another kind of problem. There are private and the public one. And the public one, well, here in my country have improved a little bit the infrastructure, but they are still things that they can be better. There you can go to the hospital.
Thank you very much. So a little bit of discussion on universal health care. That's the expression or phrase we use to describe publicly funded health care. Okay, it's not free health care. There's no such thing as free health care. Somebody's paying for it. Either you collectively as taxpayers, your company, or someone else. All right. Thank you very much, Anne. Anna, when I say health, what comes to mind to you? What do you think about?
I think about working out, eating vegetables and fruits and things like that, you know. I don't have a well-balanced diet, but I work out, so I believe one thing can compensate the other. But since MP brought up the healthcare system, I'd like to talking about it.
Okay.
Because it's a very important topic, and despite its many problems, my country um, has brought has trying to bring at least quality healthcare to poor inhabitants who were previously denied even basic care. Now we have a strategy from the government.
Thank you. Yeah, I think universal health care is a good idea. It's hard to find too many people disagreeing with that in the United States. A lot of countries have it. All right, Carolina, what are your thoughts on health? What comes to mind?
I think that health is the one of the most important in our life. I think that people have to stop eating junk food and trying to be healthy. So I think that if people are healthier, maybe the problems in the public system of health will reduce, because if we do exercise and try to eat vegetable and fruits and proteins, maybe obesity can we can prevent the obesity in people. So that is my thoughts.
Thank you, Carolina. Very interesting, and I'm going to throw a hand grenade into the discussion, see what happens. Latest research indicates the main reason for obesity is sugar. Processed foods, essentially. They contain a lot of sugar, especially low-fat products. And it is sugar that is the leading cause of obesity. That, according to the latest research. I'll shut up now, and now I'll turn to German. German, what's on your mind regarding health?
Health is an interesting topic. It's difficult because it has different sides. For example, what about the mind health? For example, trying to avoid the stress or difficult situations because your body or your nerves can be affected. So I think it's important to have a good mental condition. Also take care about your body, maybe exercising or working out, and be aware about the food, the sugar, the salt, sodium, and the processed food and different things. Also, it's important the medical plan. In some countries, it's difficult to have a good public plan. In my country, for example, the public health it's not so good, and health is very expensive.
Thank you very much. Thank you. So yeah, again, that discussion of public health, but I also heard balance. There's nothing wrong with having an ice cream or a chocolate bar or a can of pop once in a while. But these foods are not necessarily the best for us. It's about balance. Too much sodium can be bad. We got to be careful, though. Sometimes we chase things such as cholesterol. Well, cholesterol is really bad for us. Well, is it? In fact, cholesterol is essential for our bodies. If we could eliminate, if it was possible to give you a pill to eliminate cholesterol, you'd be dead within a day. It's essential for the mind. It's essential for the body. So a little bit of balance. All right, enough of saying that. I've dropped 2 hand grenades. Maria, what comes to mind when you think of health?
For me, health is the most important thing people have, and I think that in Spain has a good health public, and when I was living in the United States, I realized that not all people can go to health center, because sometimes they don't have a good financial plan to solve the problem. And I think that some countries don't realize how much important is the health of people, and I think that countries should solve this type of problem, like in Spain. What else?
I see time is up, so that is perfect.
Oh, okay. Thanks.
I personally think that a universal healthcare system is very good, especially if you're prone to sticking your finger in your eye like I am. Yes. I have dry eyes right now. That's why I keep doing it. I like the fact that I actually just had to go to the doctor. My back is really bothering me, and I can go in, I can see my doctor, and I can also get specialists, and I don't have to worry about paying for it. I don't like paying 55% tax, but you know, there's a certain level of service people expect, and it's not free. And when you look at your income tax, you look at your sales tax, you look at your property tax, you look at all these taxes, they are quite high, so you expect a certain level of service. But healthcare, I think, is one of those very important things. All right, and last for round one, we have Ian. What is important to you about health? What do you think about? What do you like to do?
So we're supposed to talk about this topic for 1 minute. I have 1 minute to go.
You have 1 minute in the first round, then I'll give you guys longer talk time in the second round.
Oh, this is really challenging.
Yes, it is.
So talking about health, yeah, it's very important. My health and my kids' health, my parents' health, it's all time for me. Well, if my kids, they need to see doctor, I have to apply for vacation. If my parents need to see doctor, I have to apply for vacation. And I'm a software engineer, and my working time is flexible. It's very flexible, but still I need to work overtime to catch up the time that I spent for my family members. So, and before I was.
Thank you. And you remarked that
okay.
1 minute isn't enough. Well, the first round is designed that way. I want to put you guys on the spot to think of, so that way you're not really thinking, you're not prepared, you're just talking about whatever comes to mind. It's what we call thinking on our feet. Now in this next round, you have a lot more time. You've gone through the first round, you know what didn't work for you, you have a better idea of how to communicate, and I'm going to at least double your time. But I'm going to give you an option. And again, this is where you guys get to vote. Would you like 2 minutes or 3 minutes to speak? Because what I'm going to do is I'm going to pair you up with another student. Okay, so German and Carolina, you can choose 3 minutes. You can re-vote again if you like, because I'm going to pair you up with another student. Right, 3, 3. 3. Okay, well, let's do 3 minutes. We've only got 6 of us, so it won't take too long to go through. So again, some of the ground rules. Ensure that your partner has equal amount of talk time. Try to focus on shorter questions and brief answers. In English, quite often we get into these short questions quite often, especially at work, before a meeting. We only have a few minutes, sometimes less than 5, and this is the type of conversation you'll have. Or in an elevator, you might even have half a minute to a minute. So getting used to these shorter conversations is beneficial. Plus, I've only got 60 minutes. There's only so much I can do with the time I've got. What I might do next week, though, is I might have 2 classes back to back, make them both conversations, and we'll just continue over the 2 time zones. All right, so yes, the same topic. Let's deal with health. Amp and Anna, I'll start you guys off. I'll let you decide what you want to talk about. Ladies, you have 3 minutes starting now.
Yeah, the health care system, I think that is very important. Here, if you don't have a private one, probably you have to wait for months to have a doctor appointment. You know that your problems that cannot wait for a while. I don't know in your country what
Yes.
happened there.
It's the same to get a specialist. However, nowadays it is much better than in the past because in the past Brazilians used to joke that they had to die before the authorities paid any attention to them. And now we had a strategy from the government called the ESF, and I work in one of this kind of community outreach. We
Yes, here.
work in a attached territory with a community.
Yes, here, for example, there if you can maybe have a private attention, and then the social security is going to pay for that. You don't have to go to the hospital, just to the private clinic, and you just say that you are from the social security, and then just give you the attention that you need. It's much better than before, yes, but it's not completely
How,
perfect. Mhm.
how does it work?
Well, these kind of clinics have kind of settlements agreement with the government, and they pay attention. They gave attention to the patients from the security, social security. So it's a way that the
It's
government fund.
like a first door to join the health system because
Yes,
sometimes people need specialists and hospitals.
yes, they are specialists. Yeah, you can find the specialists at the hospitals or just in private clinics. That depends on
And
how.
what what about who does not have a security?
But you don't have. You have to go to the public hospital, and probably you have to just a general doctor attend just to evaluate you, and then he sent to the specialist, and yeah, probably you have to wait for 2 or 3 months if you are for lucky guy. Yeah,
Oh yes,
you
the
don't have.
same here. All right.
Thank you very much, ladies. A doorbell and a chime going off. So I've typed a little bit here. If you notice, there's some vocabulary in there. So we talked about universal health care. When you have to wait to see your doctor, we call that a wait time. When you have to wait for a procedure, which can take months, those are considered wait times. We have primary care physicians or family practitioners. We call these our family doctors. When they send you to see somebody, we call those a specialist. A surgeon is somebody that cuts into you. Pharmacare, that's when not only do you get public supported healthcare, but it's also they fund drug programs as well. Two-tiered is when you have a public and a private system. All right, enough of introduction of vocabulary. Next we have Carolina and German. Guys, feel free to continue on the same topic or jump into something completely different related to health. Remember, health is more than just medical access and treatment. There's other things such as naturopaths, there's health, there's eating, there's so many things. Guys, you have 3 minutes starting now.
Okay. Hi, Carolina. Any suggestion of topic?
Yes. Hey. Okay. I wanna tell you about the private system here in Colombia. We have two system too. One is private system, and the other one is public system. For people who have who pays a private health, for them it's more easier to get an appointment. But for people who only have the public one, is too difficult to get an appointment. They have to wait maybe 1 month or 2 months to get a specialist appointment. I don't know in your country it
Well,
happened in
I live in Chile. I think that our countries are very similar in many ways in transport, education, and also in health. It's the same situation that you described. And for example, you have an appointment in a private clinic. It's very fast, but it's also very expensive. Here it's about, for example, in a normal clinic, it's about $80 for 15 minutes for a doctor. I don't know in Colombia.
it's like maybe it's dependent on your salary.
Oh no,
Maybe
yeah. I mean, but for example, what happens is you go and pay a part of the amount that the government discount every month.
if you pay a different amount, maybe you have a good system of health.
Okay. And how much is the rate tax that you have to pay every month?
Maybe 12%.
12%? Oh, it's the same here. I think the countries are the same. It's not
But
so good.
I tell you one thing. I heard that in Chile, the license of pregnant women is maybe 1 year. But
No,
here,
it's 6 months.
okay, but here is 3 months. No, so
Um, oh,
I think
that's pretty bad.
that yeah, I think that your system is better than here.
Probably it's a little more advanced, but are very similar. Probably in a couple of years or maybe in months, your system will be the same for pregnancy.
We actually
I'm
refer
sure.
to that as maternity or paternity leave. So in Canada, it's a year, but it's split between the two parents. So in my case, I'll let my wife take the entire year, but we could have split it 6 months apiece.
That is a good one.
It is.
Yeah.
Some countries do
Nice. Yeah.
more. Some countries it's fully paid. In Canada, I think it's 50% of your income. But then what some employers do is they increase it from there. So it's important. Some countries don't have anything at all. It's not easy. Also,
Yeah.
another thing that was being talked about is what we regularly call user fees. So you may have a publicly funded system, but then you might still have to pay a small fee when you show up.
Mhm.
Some of these words are not used very much in the United States because they don't have a universal health care system. So these are not terms that are commonly used in situations. The US is a pay fee situation, which is offset with insurance. All right, next we have Yan and Maria. Ladies, you have 3 minutes. Like I said before, continue
Okay.
the topic of health, but you may deviate as much as you want within that topic. Go ahead, please.
Okay.
What we should talk about?
About diets, because
Diets? Okay.
yes, I don't believe. Well, first or true. I don't believe in diet. I believe in a balanced food because I think that it is very hard to make a diet for life. Besides, I think that sometimes your body needs sugar or sweeties or candy ice cream. For this, I don't believe in being a diet. What do you think?
Well, for me, I I actually don't pay too much attention to diets. I just I like do whatever I want. I just eat whatever I want, but make sure I run for 40 minutes or 30 minutes per day, and then I do whatever I want. That's my way. So if it's ice cream, it's okay if I just once per week or occasionally, but not every day. I think for diet, it's very religious related. Some people believe some food is not eatable, and some people think eating some food is kind of is doing the bad thing. So I don't know how to discuss the diet. I even think if I say I ate something that could be an offense to some other students in this class. I don't know.
No, speak freely. Don't worry. As long as you're respectful of others,
Okay.
it's
Yes.
okay to talk about this. There are some foods that, like pork is a very, very important meat for the Chinese people, but Jews, for example, pork is considered unclean. But there's nothing wrong with talking about that. Continue, guys.
Yeah, how do you know I'm a Chinese people?
You look Chinese to me. My wife's Chinese, so I'm a little bit familiar with Chinese culture.
Okay. No, I'm not Chinese.
You're not. Oh, you look Chinese. I'm sorry. Where are you from?
Yes, I'm just kidding.
Okay, stop it.
Maria, what do you want to say? But I like this name. Maria is not like saying people.
What did you want to talk?
I don't know. It's really challenging for me to keep talking for even 1 minute. I can see that. Oh, 7 seconds.
Yeah, there's not much of a challenge anymore. Time is up. Cut off. All right. Well, that's part of this class. I mean, look, if we were all friends and hanging out, we wouldn't have timers on our conversation. That would come naturally. But this is a learning environment, and one of the things I'm doing is trying to teach you guys to, I'm putting constraints in on short times and trying to get you guys to communicate together and to click and to try to find subjects that mean a lot to us, where you have an opinion, and instead of talking about something like, I don't know, what do you think about taupe as a paint color, right? Or instead of saying, hey, what do you guys want to talk about today? So I'm trying to facilitate that and help you guys with a few tips and tricks as well. One thing I noticed in this round that you guys didn't necessarily do, and in some cases you guys weren't familiar with each other, it's always good to start off with some introductions if you're not familiar with the person. Some of you guys did it quite well. A good example would be, hi Maria, how are you? And they say, hi, I'm so-and-so, you know, I'm Simon. What would you like to talk about? And then you just simply move along. You don't have to get really complicated. And sometimes when you don't know what to say, start off with a question. Let the other person lead. And then you've got something more to talk about. So we come up to our third round. Guys, how many minutes would you like this time? 2 or 3?
2, please.
Alrighty then. Somebody wants 2. Okay, what about the rest of you? 2 is looking good. 1 vote for 3. 2 votes for 3. It's split. Amp, okay is neither 2 nor... Okay, so I've got 3 votes for 2, so let's go with 2. And somebody sent me in... No, don't call me now. Just a minute, guys. I don't want anyone calling me during class.
Hi, Anna. I want to say hi to you.
Oh. Stop. Okay, so 2 minutes. And I'm going to change it. I'm going to change who you get to talk to this time. Amp, you're going to speak with Yan. Okay, you've got 2 minutes. Oh, I better reset the timer. Where's my timer here? It just closed. All right, so you guys have 2 minutes starting now.
Well, Jan, nice to meet you. I'm from Ecuador, a small country, related with your big country. But the health care system, I think, I don't know how to work in your country.
My country? For if it is in China, so people usually they have a public health insurance system. Make sure that you pay some about 100 or 200 RMB per month. Then you will get reimbursement. I think that's 8% reimbursement if you need. But usually those reimbursement happens only to those very common medicines. If something really bad happens and you need some very expensive medicines, and those were not covered by the insurance.
That is for people who works. What happened with people that is not working, like the babies? Your payment covered your child, for example?
For babies, if baby will usually be dependence of their parents.
Yeah.
If the
Exactly.
parents are working. If the parents are not working, then they can apply for the special recovery from the government, and they can cover some kind of, in theory, kind of insurance,
And
health
the
expenses.
attention is fast. For example, if I have a pain now in my back, how long I have to wait until
Oh,
I
for this kind, like how long you can get appointment with doctor?
yeah.
That's very special in China that we don't go to doctor by appointments. It's all walk-in policy.
I
So
believe, if I remember correctly, you don't necessarily go to see a doctor's office, you go to the hospital to see a doctor. Is that correct, Jan?
correct,
Yeah.
correct. The outpatient department.
See, I know a little bit. I know a little bit. I got sick when I was in China and I almost had to go to the hospital. And I said, no, I don't want to go to a hospital because unfortunately with hospitals, there's lots of sick people. Sometimes you can get sicker by going to a hospital. All
That's
right.
true.
Next round, we have Anna. And who am I going to pair Anna with? Anna and German. You guys have 2 minutes. Go ahead, please.
All
Uh,
right, Friday.
we can
Monday
talk
and
about
Friday.
movies related to health.
All right. Which one? Have you seen anyone related to health
Uh, a lot of
recently?
them. The typical movie about the U.S. government that it's a quarantine with a lot of people dying, but I don't know. I don't know the name. Always are
All
bad
right.
movies.
But
Another topic.
tell me a little bit about the plot.
About what?
The plot of the movie that you saw.
Oh yes, the typical movie that it's in a military camp with a lot of militaries and
Mm-hmm.
people is sick by a weird disease or maybe for example a chemical weapon and they try to save the population and there is a typical doctor that is injured by the militaries and the suit is broken and they became infected. You know, this kind of movies.
Okay, but tell me, Friday, do you fear a bacteriological weapon or something like that? Do you think it's possible? It's possible, you know.
Yeah, it's possible
We
there,
we had okay. Tell
but
me.
I think that are not correct. They are very dangerous and immoral, I think, in my opinion. I don't know. What about you?
I fear. I read once that someone discovered a new virus, a new influenza.
Oh, rats. We're just getting ready to talk about a new virus. I love that part. Unfortunately, we'll have to wait till the next round. So now we have Carolina and Maria, I believe. Yes, it's Maria. Ladies, you have 2 minutes. Before you talk, if you want to continue on movies, there's a couple. There's Sicko, which is a documentary, a rather popular one in the United States for people who like it and hate it. There's Shaun of the Dead, a zombie movie, a very humorous British take on that subject. And of course, World War Z, one of the worst zombie movies I've ever seen. All right, ladies and gentlemen, you have 2 minutes. Go ahead, starting now.
Okay, teacher. Hello, Maria. What do you like to talk about?
Whatever you want. Hello. Nice to meet you.
I don't know if you want to talk with me about diets. It's okay.
About, sorry?
Diets. Your your
Okay.
last topic.
Okay. It is okay.
Okay. Do you ask to Jan about diet, and you say that you don't believe in diet? Do you want to tell me the reason?
Yes, because um, I eat all foodstuffs. I make sport and everything. For this, I don't believe in diet. Besides, I think that being a diet is so hard, and sometimes you feel very stressed and you lose your diet. For this, I don't believe. Do you believe in diets or?
I did a kind of diet at the beginning in this year, but I only my diet was uh, don't eat sweets and bakery and soft drinks, and also I try to don't eat a lot of sugar. So I only eat healthy food like proteins and vegetables. And one day at the end of the weekend, maybe Saturday night or Friday night, I eat everything that I wanted, like hamburger with a special chocolate dessert and fatty food, junky food. So it was a kind of diet for me.
Well, today's my birthday, so maybe my wife will be bringing me some treats home. Maybe some taro pastries or some sweet potato pastries. I like taro cake. It's so yummy. And it's purple, too. That's really cool. Or green sometimes. I don't know why.
Happy
All right.
birthday, teacher.
Yeah, well, I turned 36 today.
Wow.
Happy birthday.
Thank you.
That's serious, right?
Why would I lie about that?
Okay.
No, it's it's today. I think it was at 6 o'clock in the morning. What a silly time to have a baby. I promised that when my wife had a baby, we'd have it at a much more respectable time, and we did it. We were just before 8 o'clock in the evening. All right, guys, we still have a lot of time left. So, oh, you want to see if you can guess my real age? Okay, let's play Guess the Age game. So we'll play a little numbers game. See if you guys can guess how old I am.
20.
Oh, you're a sweetheart. Who said that? Is that Yan?
Yes. Yeah.
46.
I think the reason some of the others are guessing high is they kind of remembered me talking about it last week. I'm actually 45 today. Yeah, that's old. Yeah, wouldn't lie about it. So there we go. All right, let's get back into talking. So I'm going to stick to 2 minutes. Health. I've got a really good topic. Okay, what if we can genetically engineer ourselves so that we don't die? Wouldn't that be awesome? Live forever? Look, what could possibly go wrong? That's all I say. I'm done. All right, so I'm going to pair you guys off in some strange groupings here. Let's go have the Carolinas talk. So Carolina and Carolina. Ladies, if you've got 2 minutes, go ahead, starting now, please.
Okay, cool. Cool, Carol. Well, okay, we have to talk about living forever. I can see some drawbacks. What about you? Would you like to live forever?
I don't wanna live forever. I just wanna live while I am healthy, and if I don't get a bad sick, maybe I wanna live to that age. What about you?
If I could have a good appearance and to be healthy, I'd like to live forever. But I can see some drawbacks, you know. Life would be really boring, and you know, the impression that we have when the time pass by is different according to each age, you know. I read about it once in a class, and if we could live forever, our mind would be messed, you know.
Our
The
mind will
memory,
be. Sorry, Caro. Your mind could be what? Sorry.
I think
our
the
mind,
medical term is deteriorate.
Ah, okay, okay, okay.
No,
Let's
not
continue.
deteriorate, teacher. We we could become unable to remember all memories. The time would
Oh,
be
okay.
confused. I read something about it once. What
You
do you
could also
think?
develop implants, so
Yeah.
that way that wouldn't be a problem. That's also a possibility, right?
But okay,
Thank you, ladies.
but in this case, the implants doesn't have
Oh,
memories,
oh,
our
stop.
memories.
Stop. I,
But you
I'm.
say, teacher, you say the implant, so but the implant doesn't have our memories. I don't
Well,
know.
you know what? That's what I want you guys to talk about, right? So I'm throwing out little hand grenades, letting them blow up, and then you guys decide what you want to do with the pieces, right? So I'm
Okay,
only
teacher.
instigating conversation.
Okay,
All
teacher.
right, Amp and Yan, you ladies have 2 minutes. Maybe. Oh, wait a minute. Oh no. Oh no. So Amp and Yan, go ahead. Let's see if you can handle any of those hand grenades I've thrown out there. Eternal life, no consequences. What could go wrong?
Yeah, what could go wrong, Amp?
Eternal life, well, if you are the only one that are survivor and you don't have your family around, I don't think that I would like to be alive. So you are the old one that nobody else is beside you, nobody that have the same thought that you, the same ideas, and so nobody contemporary for me. To me, I think it's not interesting.
But what if everyone has internal life?
Yeah.
What
Is
could be?
everyone eternal life?
Oh yeah.
Yeah,
Well,
not only you.
that it would be the paradise. If we have everything, if we with the world that we are now, a lot of pollution and contamination, without food, without water,
But it
it's
wouldn't
not
kill
going
you.
to be. It's not going to be a paradise at all. If we had a good conditions, yeah, it would be great. What
I
do you
think
think?
I think some people might lost their job, like the people working in hospital, the
Mhm.
people that is running a gym, or people that working with health support or nursing. They
Mhm.
could be. They need to find something else because we won't die
Yeah,
anyway.
probably they can
Oh,
they can choose another kind of profession.
and
You know,
yeah, and
lately many professions have appeared, so it's the same.
or if someone is really angry, he want to kill some other people, how would they do?
Oh, guys, they've come out with a TV show for this. It's called Forever. So what happens is when they kill the guy, he comes back to life, but he somehow finds himself in the Hudson River in New York City. So don't worry, they've got a TV series for that. So you can't die. You can kill somebody, but they just come back. And they're unhappy, of course, because you killed them.
And revenges.
Well, if somebody killed me, you know what I'd do right next, right? I'd call off and punch them one. It's not cool. All right, next. You know who's up next? We have German and Maria. Eternal life. Nothing can go wrong, right? 7.5 billion people having babies, nobody dying. I couldn't see the problem. What about you guys?
Hi,
Well,
German.
hi Maria, you can start.
Um, I see a lot of problems because if nobody's die, there will not be source for all people. And here there will be a big problem. All people try to fight or hit other people to get any source. Besides, there is a little problem: the climate change. If there are less resources. For this, I think that live for a life is a big problem. What do you think, or do you agree?
Oh, I agree with you. I think there will be a huge problem because of the food, for example, or what about the water, or even the fuel, because now we don't have a lot of gasoline. Imagine if never dies and children or babies are are growing up all the time. What can we do? What can we do? Yeah.
Yes, but for me, well, having fuel or not, this is no, it's not a big problem. The problem is the overcrowded because there aren't any crops to eat all people. I think that in a future, fuel there isn't a problem. There will other things. The problem is the food.
Yeah, food. Talk about hell on earth. Never being able to die but being hungry and thirsty all the time. That wouldn't be fun, would it? All right. Last round. This is where you get to have one more one-on-one with me. And what I want to do, again, we've got about a minute because there's only 10 minutes left. I'll start with Amp. And Amp, I want to know what you thought about this subject. Did it make you think? Did you enjoy it? Go ahead.
About health?
Yeah, what about health?
Yes, I liked the subject. That is why I just was supporting this idea instead of the others.
Mm-hmm.
And because all of us, we have to take care of our attention, pay attention to this subject. The and not just for us, just from the people that is the next generation. It's something that maybe before people live a little more because have a better uh, way to feed ourselves themselves, and now we just eat what is fast but is processed. So you know the
Yeah.
processed
I
food.
think that could
It's
be. I personally think processed food is very, very bad for us, and we should avoid it.
yeah.
Thank you very much, Amp. Anna, what did you think of today's subject?
As usual, I really loved our class very much, and I have no words to thank you.
Well, it's okay.
And yeah, that's true. I'm not being ingratiating. I really think it. And the topic was great because health is very important, and you are almost convinced me to follow a diet and try to get rid of sugar and processed food. You know, maybe in the future, after taking a bit more classes, I will give in it because of you.
Well, you're a
And
smart
then I
girl.
will have more reasons to thank you.
Well,
Like
you're a
my,
smart girl. I think there's plenty of research to take a look at, but you've got to want to not do it. But I'll tell you this, because I used to eat a lot of junk food too. After about a month or two of not doing it, you'll actually prefer the healthier stuff, and then when you go back to junk food, you won't enjoy it the same way. Although that's not the case with pizza. Really good pizza always tastes good. All right, Carolina, what did you think of today's subject?
I like that this kind of subject because it's a typical subject or conversation in our lives. So for me, it was good because it's the way that I learned new vocabulary associated with a sentence or with a situation. So for me, this class is really, really good. And also, I have the opportunity to speak more fluently with you guys. Thank you for all of you.
That's one of the reasons I do this. I've been teaching English online for many years now, and the one thing that keeps coming back is we want to talk more.
Yeah.
I don't waste a lot of time with grammar because you know it. You probably know grammar more than I do. And it's not about the framework of the language, it's conversation with the language.
And I think that the best way to practice grammar is to speak with someone in an interesting topic, because sometimes I don't understand a lot of things of grammar. For example, subjunctive or something like that makes me crazy. So for me, it's a good way to learn or to speak English.
Well, the good thing about conversation classes, well, I don't teach grammar, you hear grammar. And, you know, talking about the future tense, talking about past tense, well, it's not that simple because we don't always talk about things in the past, the present, or the future. Sometimes we're talking about things in the past and the present at the same time, such as I have been teaching an English class. Well, that's talking about something that happened in the past and is continuing up to the present. But I don't do grammar so much anymore because I do enjoy conversation classes more, and these classes are very popular, so I'll keep doing it. Thank you for your comments, Carolina. German, what did you think of today's class?
Oh, I think I always is a great class, like all your classes. And also because the classmates are very talkative. And the subject it's very easy to speak these kind of things because they affect our daily life. And also I would like to speak in a new class of the one government, one world government, and talk about conspiracies and money. I don't know. I think different topics are interesting, and we can know better the classmates and their opinion and what they're thinking.
I will include those, and they're not just joke subjects. Now, the reason you like these topics is because I pick them because we all have an interest in them. And if you guys are interested, you know about it, you're not thinking about English when you're talking about it. You're wanting to participate. Your mind is working harder, focusing on the discussion rather than going, oh, English, what do I say next? And that's why I do it. So one world government, well, and the interesting thing about this, that involves talking about trade negotiations. So right now there's the TPP. It's Pacific Rim companies getting together. Well, all these trading blocks, these tariffs being brought down, are what brings us closer and closer to a one world government. So it's all related. And the other topic I chose, robot armies. There's talk in the papers about using robots instead of people. The US is working on aircraft that will be piloted by artificial intelligence or remote controlled. Well, that essentially makes these robots, right? So everything I'm doing, it might seem a little crazy, but it's not. All right, thank you, Jerem, for your comments. Maria, what did you think of today's class? What did you like about it?
I really like this type of class. Today is my first time in this class, and I really like this topic because thanks to this topic we can talk each other, and we can improve our vocabulary and speak with fluency. For this, I like this type of topic and talk with other people who are not English people, to try to understand English in foreign people. I think that this is a good way to learn English.
Good. I do speak a fair amount of time, so that can help a lot of you more advanced students, give you a chance to speak with me. But also a lot of the students coming to this class are advanced, so if you're not exactly where you want to be, you can learn not just from me, but from other students. As I have said before, you're not going to move to an English-speaking country and speak with just native English speakers. We don't exist anymore. We're a cosmopolitan society. Our cities, my family, half Chinese. My block alone, I've got Chinese, I've got Indians, I've got Russians. It's much more of a global village now. Thank you, Maria, for your comments. And last but not least, Yan, your thoughts on today's class.
Oh, health is not a good topic for me. My vocabulary about the health or the medical system is so limited. That's why I found very difficult in the first conversation and the second one as well. But I love the topic about if everyone has eternal life. That is good. But I have a question that since it's a conversation, did you ever, I didn't see that you correct anyone's accent or pronunciation.
No.
That will not be covered.
It's not my focus. I have done it, and sometimes I do it. But the whole focus of this class is getting you to speak. I do have pronunciation classes where it's all about pronunciation, but quite often I find that these subjects are best done in a private session where I can just focus on you. And what I do is I look at word pairs and I isolate individual sounds that you're having trouble with. I try tongue twisters, and we come up with a bit of a plan, and mostly I give you a homework assignment. That doesn't work very well in a class setting. So again, sometimes I do help, but if I keep interrupting and doing vocabulary and other corrections, it takes away from the class. So the focus is on creating that conversation. The more you speak, the better you'll get.
Okay, I will get a private lesson with you.
Well, yeah, if you want to do that, take a look. And all of you know this, if you pick one class, it's a little bit more expensive than if you pick 5. But I'll leave that completely up to you. And one thing I wanted to talk about next, which is related to classes. I've only got a minute left because time is out. I have, I think, 3 classes on Friday. Oh, wrong screen. And then on, I think it's Monday and Tuesday. Let me just take a look. I have a lot of classes on Monday. I've got 3 classes in the morning, 8, 9, and 11 Eastern time. And then on Tuesday, I have 8, 9, 11, 2, and 3. And of course, I have classes on Thursday and Friday as well. So I'm on vacation, so I'm teaching more classes. So keep an eye on my schedule, guys. And if you're looking for a private lesson, you can see what's available. If you don't see a time that you want, message me and tell me what you'd like, and I'll open up a slot.
Oh, yeah. One more thing I want to talk about health, that I think maybe you should change your position. You said you have pain in your waist, right? I think that's a back. That's directly related with your sitting position. You're sitting on a stool, right?
No, I'm sitting on the floor.
On the floor, and you don't have back support.
I know what you're saying, but with my back problems, what works best is either laying down or kind of sitting the way I do. The reason I do it this way is it helps my back. If standing was better, I'd stand. I've taught class standing. I'm working through it with my doctors, but we don't have a solution yet. And I do have a back brace. You just can't see it.
Okay.
It's under my shirt. I don't show it to people. It's personal. So, but thank you for your concern. Guys, I love having you as students. Trust me, this is not what I consider work. I enjoy this a lot, and I enjoy having this conversation. I just wish I could do more talking with you guys, but it's about you, not me. So, have yourself a wonderful night, guys. Yes, thank you. I'll probably have a little bit of cake when my wife gets home. I'm not here tomorrow. Funny enough, I'm working my birthday but taking tomorrow off, but I'm back on Friday. And I might have some classes on the weekend.
It's 7 p.m. and your wife is not at home yet?
That's correct.
It's 8 p.m. at your time?
It is. Yes.
She's a nurse?
No, she works at a tour company, so she likes to go in later, and so that means she comes home later. That way she gets to spend a bit of time with her baby in the morning.
Oh, baby. It's still baby?
Well, he's a toddler. He's 14 months, so that's still kind of a cross between a baby and a toddler.
Okay, it's your first kid?
Yes. You guys aren't going to let me go, are you?
No. Happy birthday.
Thank you. Here, I'll show you guys a picture of my little creation. Where is it? Oh, this is my son with his date.
Okay, the other one is your son's girlfriend?
Yeah.
Good.
Yeah. Boy's already got a girlfriend at the age of 14 months. All right, I do need to get going because my wife will be home in a little bit, and I want to shower and change. It's been a long day. Guys, again, feel free to contact me outside of class if you want to send me a message. I always do pay attention. Again, thanks. I enjoy these classes probably as much as you do.
Thank you, Simon.
Happy birthday.
Thank you very much.
Happy
Thank you,
birthday.
teacher.
Thank
Happy
you.
birthday.
Bye bye.
Bye-bye.
Bye.
Good night.
Bye bye.